Yeah, so transfers between hospitals is a bit of a tricky problem because a lot of the ICU item numbers that you can claim, they're meant to be for a calendar day. So the most prominent ones are really the daily management in ICU, so the 13870, 13873, and they clearly state that this is for a calendar day. And it can only be claimed by one intensive care specialist, regardless of how many may be involved. Now, usually, if the patient's in-house, this doesn't really cause a problem. But if they get transferred between institutions, then by definition, there will be two intensivists involved in their care, and this is not recognized or reconciled in the MBS in any shape or way or form. So only one person will get paid, and usually there is no rhyme or reason. It's the first person that puts in the claim. So the quickest person gets paid. Why only some of the items get rejected is because some of the items you can claim more than once a day. So pressure monitoring, for example, it's not defined what sort of pressure monitoring items you're claiming. You can claim up to 4 monitoring items a day. Theoretically, the individual monitoring items relate to the pressure that you're monitoring. So if the patient had an arterial and a central venous pressure monitoring at ICUA, and somebody claimed for that, and then they get transferred, and you claim it again in ICUB, theoretically, that's not a legal claim. And although the MBS will pay for those claims, in practice, you shouldn't be submitting those claims. So what should technically happen is between the two hospitals, the transferring and the receiving hospital, the two intensivists should have a discussion about who's going to claim for the patient. Now, I know that in practice, this never happens. And I think that's really something that you as the person doing the billing has to then weigh up. If the patient gets transferred, is should I be billing? Is it more likely that they bill at the other hospital? And sometimes it's obvious if they've only spent a short while there, and then you spend the whole day looking after them. But often it's not related to people's appraisal of the amount of time that gets put in, but it's whoever gets their billing in first. But just be wary that you do expose yourself to some degree of risk, because even those, some of those items will be rejected, which is not a problem. It's just annoying that they're rejected. But the ones that get paid, they may be items that actually shouldn't be paid in the first place.